So you're still in good spirits, which is good.
Trying. Yeah, yeah.
So what's tell me a little bit about what you do.
So I'm at the basics, right? I'm a geriatric care manager. I have, my background is I'm a nurse. Most people who do this work come to it from a background of nursing and social work. A slim slice of people who come to it from other backgrounds, but by and large, it's nurses and social workers. And I'm a nurse, and I have a team of 8 care managers made up of nurses and social workers. And I always say we specialize in helping folks over the age of 65 connect with the right resources at the right time, with the always the goal of making sure that whatever we're recommending, any plan of care is controlled by or is driven by the finances and resources available. So we want to make sure that we come up with solutions that have sustainability, and that if and when the money runs out, and it almost always runs out, the person is receiving care that they can continue to receive on entitlement benefits. But we can help people through a crisis. We can help people long term. We have many clients that we're supporting at home in assisted living and nursing homes.
You've helped a lot of our clients in crisis.
Yeah,
I
yeah,
know I'm always trying to call your cell phone.
yeah. That's my only number.
So now with the coronavirus, are you seeing some your clients that are in assisted living facilities or nursing homes, how are you connecting with them?
Well, I can tell you that about 2.5 weeks ago, it was 2 weeks ago Monday, so we're really, yeah, about 2.5 weeks ago. I've been watching the CDC website, World Health Organization. I was going to some academic websites, Harvard and Columbia, to really kind of find out what we know so much more than we did even just a couple of weeks ago. But I was seeing what was happening, and I started to track it, and I started to think about our responsibility to our clients. Like I said, we have clients everywhere. Sometimes they don't have families. Sometimes the families are far away, and really our job, whether the families are nearby or far away, is to help them make the best decisions for their loved ones and make sure they're getting good care. So I started thinking about it then, and I put out an email to the care managers saying, for those who are home, make sure, like, we need to start making sure that they have certain items in the house. And I divided it into 3 categories. One is symptom relief. Somebody gets sick, to make sure they have Advil and Tylenol in the home, because if you have a sustained fever, you can alternate. They were talking in the beginning that there were more GI symptoms. So I was recommending having I just want to say Lomotil. It's Imodium. Now it's called Imodium. It used to be called Lomotil. But having Imodium, Pepto-Bismol, like Tums, things in case somebody has GI symptoms, making sure they have a thermometer in the home, and that if they're home with a caregiver or not, that there's somebody there who knows how to use the thermometer, because now a lot of them are digital. So that was like the one category. The next category was having some extra non-perishables. I wasn't recommending that everybody's stocking themselves fully, like as if it's, an underground shelter, but just having extra non-perishables around in case this develops into something bigger, which it has. And then the third category.
Wait, so you didn't recommend buying out the toilet paper aisle?
I didn't. In fact, toilet paper wasn't even on my list.
So what were some things that were on your list?
The things that were on the list were like peanut butter, canned soup, spaghetti sauce, frozen items, things like just things to have around that were extra. So it was, and then I also recommended people get saltines and ginger ale, again, if there were GI symptoms. I was kind of worried about that. So I got that out to the care managers early. So their antennas were up. They were like seeing their clients, and they were starting to assess to make sure that they had everything that they needed. And then the following week, which was 2 weeks ago Monday, I made the decision not to have the care managers. My son is here.
Mine
yours is too. Hi. Okay, here, hold on, just have to help him with the shirt.
And then I took a video of me on speaker.
All right. Okay.
And,
Good job. All right. You gonna go listen to your music or something?
No.
Why don't you go get your iPad?
No.
but it just took a video.
I might have to escape.
I got a different picture of this.
Take
It's
a picture.
You're welcome, buddy.
Okay.
That's okay. I'll talk to her about it, okay? Don't worry about it.
unless she gets.
Okay, that's fine.
I think
You're done with both of them? There's no more?
No.
Okay, that's fine.
He's so cute. He's your older one, right?
Mm-hmm.
Oh, okay.
He's my mini me. He's
Aw.
so cute, but it's trying to work and then be a
Oh,
teacher and
Right.
do math not the way that we were taught to do math.
that's right. Oh, that's right. I just saw something the other day. It's a little meme and it says, if you see me muttering to myself, mind your own business. I'm just having a parent-teacher conference.
Yeah, there's a lot of those. She's like, it's day 2, and so far 2 kids are in detention, and the teacher is getting arrested for drinking on the job.
Right.
So yeah.
So anyway, so a week ago Monday, I made the decision again, following what I could see was happening, that I didn't want my care managers to visit anybody who was in a facility for an incidental check-in visit. Let's wipe that out, because that's a place I could see, they've been saying from the beginning, it's the elderly who are most susceptible and most vulnerable. A check-in visit is not essential. Their basic needs are going to be met by the facility, and we can follow by phone. There were a couple of clients in assisted livings who had like essential doctor appointments. And at that point, nobody was locking down. They were beginning to start asking questions when you went, if you've been out of the country and all that sort of thing. So a couple of our clients did have to go to essential appointments, but I told them to cancel anything that was non-essential. And then like shortly after that, the assisted living started shutting their doors, and the nursing homes, to visitors. So we were like a little bit ahead of the curve there. And then this Monday, just earlier this week, I had to make the decision that we're not going to be face-to-face even with our homebound clients anymore. And it's to protect them, because, some of my care managers have young families, and they've been going to basketball games, sitting in gyms, and they've been around people. In the beginning, the CDC was saying that it didn't appear that the virus could be spread unless the person was actively sick, which would have been a wonderful gift, because it would have been a lot easier to control the spread. But now they're saying you can just sit next to somebody for 10 minutes and that could be long enough. So on Monday, that's why I said no more home visits. But we do have, we have like more than several clients whose medications we set up at home. Not all of our homebound clients have us set up their medications, but we have probably, I think, somewhere between 8 and 10. So the care managers ran. Oh, go ahead.
So what about the clients that you have that are home? Their check-ins, like, are you just calling them? Do they have people in the house with them? Like, what about
some of them do? Most of them have a home health aide. So what we did was, first we got a month's worth of medication. Some people we could only get 2 weeks, but everybody has anywhere between 2 and 4 weeks of medication. Most people have 4 set up in their house. So that's good. And then what we're doing now is, with our clients who are in facilities, we're calling like 3 times a week just to get a check-in with the nurse. How are our clients doing? We have one facility where we have 4 clients. So instead of having 3 different care managers, call, we're having one care manager call for everybody, and we're keeping the families updated. And, I think it works for the families, and I'm sure it works for the staff, because we know what questions to ask. We can make it a very short phone call. It's not a big chat, and, we can kind of get to the meat. And then we're sending the families updates after every time we call, so that they know what's going on. And one of the questions we're asking is, is there anyone with known coronavirus in the building? And so far, knock on wood, no. In any of the facilities, there's nobody. And all of our clients are okay. One had a head cold that had us a little nervous, but she's better now. So that's how we're monitoring the people in the facilities. And it's just a way to, I know that everybody is being extra vigilant in the facilities. The care staff, I would imagine, are really on guard. They're taking temperatures 3 times a day usually. But it's just a way for them to, to remind them, like, we're still here, like we're working with you, but we want to make sure that, you know, our clients aren't slipping through the cracks. So, and nobody is. So that's good. And the families really appreciate the updates. And I'm surprised, I'm copied on every email that my care managers send out. So that keeps me up to date on how everyone's doing. And I am surprised that like the emails they're sending to the families are like pretty much as detailed as they were when they were face-to-face with the client. So they're really getting a lot of information from just the phone calls. And sometimes we have clients in facilities, we can call them directly as well and see how they're feeling. You know, people in assisted living, some of them have cell phones or rooms or phones in their room, and we can call them and see how they're doing. And now for the clients that we have home, we're calling every day. And we're asking the aides to take the temperatures twice a day, and the aides' own temperature twice a day, because often the fever is the first sign of disease, and we kind of want to be on things ahead, you know, quickly. You know, there's no cure. It's all symptomatic relief, but we want to know as soon as there's a change. All of my care managers, and I always sleep next to our phones, but I said to them, just be sure you don't forget. You know, I'm always the backup and I sleep next to my phone, but make sure your ringers are on, because if something changes in the middle of the night and the aide needs us, we have to be available. And that's what we've assured the families, is that, you know, we're on it. We're going to be limited in how much we can do because we can't go out to see them anymore, but we're going to monitor as closely as we possibly can from home. And if it becomes necessary to move the client to the hospital, it might be even harder to get information there, but we'll do our best to get the family information, because, you know, obviously nobody can go there.
So I have family in Italy, and unfortunately they're in a really a real predicament. And I know that their hospitals are picking and choosing who they're caring for. So if a senior does get sick or does have a fever, I know for either younger adults or even people that are, you know, under 60 years old, they're telling you just take your temperature, report back. They're not having you go to the doctor's office. They're not having you go to a hospital. So for a senior, is it the same protocol?
There's no clear protocol. There's nothing clear here. And that is that, I mean, I could do a whole talk just on that, on how unprepared we are. One of my employees came down with flu-like symptoms on Monday. She's 25 years old. She's otherwise healthy. She was in the office on Friday with me all day. We weren't touching or anything. We were very aware of staying away from each other. But I was putting her on a special project, and I had to be next to her for a few minutes every once in a while, you know, to kind of at her computer. And then the plan was for her to work at home. So Monday she started working at home, and she emailed me in the morning, everything's going great. And at 12:45, she says, something's different. Like, just want to make you aware, I don't feel good. She became very weak, feverish, body aches. And then I've been in touch with her every day. So that was Monday. And today she's actually starting to work a little bit again, but she's like, has this extreme fatigue. But when she called me Monday, I talked to her, I wound up speaking with her Monday night. I thought, well, let me run through this and see. I mean, I knew that we were behind. Everybody kind of knows that we were behind in getting ready for this, but I kind of wanted to see what is the protocol. So I thought I'd give it a try. It was, I guess, around 5:30 or 6 o'clock at night. So I called the Department of Health in her town, in her county, and they were closed. I called an urgent care that was nearby, and I said, you know, I have an employee who's not feeling well. What is the protocol? And the girl said to me, has she been outside the country? And I said, well, at this point, I don't even know why that would even be pertinent, because it's in the country, you know. And she said, well, I said, do you have tests there? And she said, no, we don't have tests. You just would have to go to the hospital. It was like that. So then I called the police in her town, and I said, you know, what are you being told is the protocol? And he goes, hold on. And he came back and he says, I don't know what to tell you. If you're concerned, she should go to the hospital. So there was nothing. And so what seems to be emerging is that, that you should give it 3 days at home, you know, because I think they're saying you're just going to feel pretty awful for 3 days at least. And if the symptoms aren't going away, or if they're getting worse, then call your doctor, and the doctor may or may not send you to the hospital. So that's what's frustrating. The whole age thing, you know, we're trying to flatten this curve so that we can preserve the healthcare system for the people who are sickest. But who really knows? I didn't check the stats today. They get me anxious when I see how quickly it's going up. It was like, I think Monday it went up by 80, Tuesday it went up by 89, Wednesday it went up by 160. So I don't know what it is today.
Oh, don't look.
Yeah. And you know, what frustrates me too with the lack of testing, if I may just divert for a minute, is that we're not going to have accurate stats on how deadly this disease is, because somebody like my employee is getting better. She's never tested. Right. So she's somebody who could kind of, you know, would probably, if there are a lot of people like her, which I suspect there are, it's going to reduce the percentage of the people who are dying from the disease, because we're going to really be capturing everyone who's been infected. But right now, we're only capturing those who are being tested, and not everybody's being tested. So, and I think that would go a long way toward certainly making me feel better, but I'm sure it would for everybody if they say, okay, it's not 10% of the cases or 5%, you know, it's really like 0.2%. That sounds a lot better. But getting back to your question about choosing who you're caring for, I mean, that's what we're trying to avoid. And, you know, I imagine that's got to be the worst job in the world for a doctor or nurse, to decide who's going to get the ventilator. And if it's between, you know, a 30-year-old and an 80-year-old, I think we probably both know what they're going to have to do. And I don't know if they have protocol for that. You know, maybe it's, well, the 80-year-old isn't as sick and has a better chance of recovering than the other one. I don't know. I don't really know. And it's a horrible thing for people, and it's a horrible, horrible thing for patients. For the doctors and the nurses who have to make that decision. Who's this?
This is my second one.
Hello.
You gotta say hi, and then we're gonna go. Okay, say hi.
So weird.
Hi.
Say hi. He's the antisocial one. He's the second.
Oh, is he?
He's the second. He's the one you.
He looks like a lover, though.
He's the one you apologize.
Who's the big one in the back now?
Oh, that's my husband.
Money.
That's your third one.
That's your third.
Money.
Oh, I thought you were in the thing.
Money.
Brandon, the child.
I want money.
Oh, no money? Come here.
Money. I want money.
We're training him young.
That's good. That's good.
So yeah, so in Italy, from my understanding, is it's not even like the symptoms, it's whoever is sick, they're choosing just to send the senior home. And it's a shame. My aunt actually just passed away in Italy a couple weeks ago, and
From coronavirus?
No.
Oh.
She had cancer, and her kidneys were failing, but it was going up and down. Like, her numbers were going up and down. And she definitely hit that euphoria stage that last couple of weeks. We were like, all right, she's coming back. Mm-hmm. But when she was sent home from the hospital, you know, she died in her home. And I said to my cousin, like a couple days ago, I said, you know, which in retrospect was actually sad to say, but I looked at him and I said, you know, thank God she passed away. Because she couldn't have lived through this. Like, you know, if something were, her kidneys started failing again, they wouldn't have come out to the house.
Right.
So,
right.
So, you know,
I did hear, and maybe you know, what a care manager colleague told me. She has the son of a client who is in Italy, and he said that things are finally starting to get over the hump. It seems like they're getting on top of it. Is that not what you're hearing?
No, so we actually just got a report today from the government in Italy saying that if April 15th, that it doesn't seem to be under control, that it's going to be called something. Now I have to look. It's going to be called something, and that the entire world is going to have to shut down for 21 days. So that means parliaments, everything has to close for 21 days. So, wow. Yeah, unfortunately, Italy has jumped in the thousands as far as deaths compared to China. So, like, you know, if you hear if you hear my cousin calling me and talking, she's scared. Like
Mhm.
there's just like a hesitation in her voice. She doesn't want to get us scared. It's a strange time. It's a strange time. But
It's an invisible enemy. You know, I think I remember feeling this way after 9/11,
that's what I was
which,
gonna say.
but it wasn't worldwide. It was, you know, it was in our area, which wasn't great. But this is like, you know, they're talking about the National Guard, and I'm like, is there enough National Guard to go around to all 50 states?
I
You
know.
know, this is not just a localized issue, and it's an invisible an invisible enemy. It could
Right.
be around us right now. We don't know.
Right.
You know,
It's
so
it's tough. But I agree. I feel like in 9/11 it was different though. I feel like in 9/11 it was very quick because we were attacked,
mhm,
and then quickly thereafter we worried about cleanup and taking care of our own, and then banding together as a country. So this is a little different because it's very slow and you can't see anything. So
yeah,
and you don't, like, there you can 9/11 you could see the rubbish, like you can see
mhm,
what needed to be done. Here you don't know what
right,
needs to be done.
right,
So I think
right.
that's the problem. But I will say, like, us as a firm, Bill, our CEO,
Mhm,
has been emailing us every night with this paragraphs upon paragraphs about how we'll take care of our own, and not to worry, and all these inspirational things, and shouting out the successes of everyone
mhm,
in the firm, even the guys in the mailroom, going to the office and getting the mail and meeting people in the parking lot.
right,
So in a way, it's kind of like 9/11, where
mhm,
everyone is together. It's all for one, and
right, right,
we're trying.
right.
Everybody's trying to be considerate, and we're putting our feelings aside, I think.
We have a common enemy,
Yeah,
you know.
that's for sure.
Mhm,
So,
mhm.
now the doctors that are in these facilities, are they visit? So are they still allowing them to visit and do checkups?
That I'm not sure about, because when we call, we're really talking to the nurses. We're not connecting with the doctors. And if any of our clients got sick, we might need to reach one of the doctors. But right now, we're just staying in touch with the staff. So I assume the doctors are going in, although, you know, a lot of doctors, cardiologists, pulmonologists even, you know, have canceled all of the non-essential appointments, unlike my dermatologist. Um, but I mean, even people who would be, you know, like a pulmonologist, that's probably the primary specialist. They're not unavailable, but they, you know, they've scaled down what they're doing too. A lot of them are working from home.
Yeah.
Is my understanding. So I don't know how often they're going out.
So I'm always concerned about the people that are home. I want to digress a second. I don't know if you saw that story about the husband and wife that have been together for 67 years. So they've been together for 67 years. It was their anniversary. She's in a nursing home, and he wasn't allowed to see her, and he sees her every day. And
Um,
he spent the entire week making you have to look it up. It's the most beautiful
uh,
story. I was in tears. It was terrible. He spent
uh,
the entire week making a sign for her. He
uh-huh.
stood outside the nursing home with his daughters and called her. And he's like, "Hi,
Uh,
honey." He's like, "Do you see my sign?"
uh,
That she felt like a queen.
uh,
And and it came to mind because she has dementia,
mhm.
and it reminds me of my grandmother. And
Right.
I what effect is this having on people with dementia, whether they're at home or in facilities? Is this not really affecting them mentally? Like,
It doesn't seem to be like, you know, all the emails that I'm reading that my care managers are sending to the families after speaking with the facilities and calling the clients at home is that everybody's in good spirits. I mean, that may be a gift of dementia, right? We're not making it a point to tell people what's going on in the world, and they don't really have a full understanding of what's going on. So that may be the gift.
Right.
So far, some people are saying, one of my care managers has an animal, and she's like, I don't know what his problem is, but he's acting differently. Maybe he's just not used to having us home all day. I don't know what it is, but the people with dementia are doing okay. They
Good.
seem to be doing okay.
Well, God bless. At least somebody is.
Yeah.
And then do you have any suggestions, like for families that have a loved one that's aging and that's home? I mean, you can't really see them, so.
Well, you can't, but a lot of the aides have iPhones. So if they do, or if there's an iPad in the phone, they can do like FaceTime calls.
Mhm.
They can do that. I'm actually going to be doing like a virtual assessment of somebody's home for safety, because they just called me, their mom needs to come home from rehab next week, and I can't get out there. And I can't even really see her. All I can do is call the social worker and ask for the medical records. But if what a lot of the facilities are doing is I'm going to move to a quieter place. All right, hold on a second. No big deal. Okay. What did I do? Open meetings. Oh, shoot. Okay. Sorry, are you still there?
Yep, still here.
Okay. All right, it's coming back. There we go. Okay. I'm in a new room now. Matt's cooking dinner for St. Joseph's Day.
Oh, nice.
Spaghetti meatballs today.
How ironic.
And he cooked a mean corned beef and cabbage the other night too, so pretty good for an Italian boy. But
I will say that's like, it's nice to see on social media everybody spending time with their families and getting out and going on bikes and coloring with their kids. Like before, I almost think that this is me going on my on my soapbox, but like I almost think it's like a market correction. Like we were getting so wrapped up in like the market was amazing, unemployment was low, everybody was doing well, but also too, like socially we were becoming like so self-involved and with the selfies and all of that, and now it's like more concentrated on like ourselves, our well-being, our families, what's important, the essentials. So I don't know.
There's something I'll send you. I don't know if you've seen it, but it's like, it's not an essay, it's not a poem, but it's a little story about like, what if this is exactly that? The people stayed home, they connected with their families, and I have two things that are kind of like that, and they're saying that with all the factories in China closed, there are areas of China where the sky is clear now, and people are seeing blue sky for the first time ever.
Yeah.
So I wonder about that too. One of my neighbors, I live in a neighborhood with a lot of little kids. We're the old people in the neighborhood. And one of the moms said she found this thing on Pinterest where people print up like a rainbow on a piece of paper, or paint it or color it or whatever, and you put it in your yard, and then when the families can get out later with their kids just for a walk in the fresh air, the kids can look for the rainbows in the neighborhood. So I thought that was a cute idea too.
It is cute. I saw something with Venice, and the water is clear for the first time.
See?
So it's like, so they had like a meme, and it said like, we are the problem.
Mm-hmm. Yeah.
I have to go. Hold on one second.
Sure.
And we're back.
Yeah, okay.
Um, so do you think that there's even more of a need for your services right now?
You know, we haven't been getting a whole lot of calls. Like I said, I've been getting calls here and there. I mean, definitely incoming work has slowed way down. So we have like this little dribble that's coming in, and to me, like from a work management standpoint and what we're dealing with and what we have to do, I'm appreciating the break because it's giving me time to concentrate on what I need to concentrate on. Like two things that we're facing with our homebound clients are, we have 5 of them that we do online grocery shopping for. We've been doing it for years. You place the order on Monday, it gets delivered on Wednesday. But now that everybody's shut in, you can't even get a delivery time anymore. Like they're not even going 3 weeks out. They're just saying you just can't enter it. So we're trying to find ways because our clients rely on the groceries. So this morning at 6:30, one of my care managers went to the grocery store and shopped for 2 clients and then dropped them off at their houses. But, you know, I don't want, you know, as an employer, I don't want anybody who works for me to get sick because they're doing something for clients. And we are nurses and social workers. We are givers. Like this is what we do. And we really can't be too careful with this. So I'm working now to try to find alternate ways to get groceries that require less of our actual time out of the house, because it doesn't look like the delivery is going to be working anymore. The other thing is the prescriptions, because we set up, like I said, we have about 8 to 10 clients. Some of them are okay. You know, we have like a private aide who can set it up and it's not very many pills and everybody's comfortable with that. But we have other clients who rely on us. One of them has an automatic dispenser that can only be filled by this one care manager who knows how to do it. And so we're trying to figure out other ways to get people medicine. You know, whether we have them set up in cards.
The problems are, so the problems are greater. So you're not talking about the quantity of clients anymore. It's the quality of the clients that you have now.
Exactly. They've got to be able to get food and they've got to be able to have their medicine. And, you know, the ones in the facilities we don't have to worry about. That's the facilities problem to make sure. But for the ones who are at home, that's what we're working on right now. We've come up with some ideas. We're going to firm it all up, and we have a full week to figure out the medication thing, and we are going to figure it out by Monday at the latest. It's going to be set, but you know,
you know what? It's hard on the business owner, but it does say something about your spirit and your perseverance, that you're looking for a solution, and you're doing it not for the business, you're doing it for the people that you're caring for. So I think that really does show that you're a social worker, and
we're in it.
You're just a good person. I don't know if you've thought of this, but number one is I saw Peapod on the road. That company I did see, but did you ever think, I don't know the circumstances of your clients, but I know a lot of the small business owners of restaurants are suffering right now. So maybe coordinating with some local restaurant to say, you know, I have a senior that I take care of, you know, would you be able to, you know, make meals for them? And
that's a great idea. Actually, now that you mentioned it, my bookkeeper is not my employee. She's someone I hire, and she has other clients. And one of our clients is an Italian restaurant, and that's how he's surviving now. He's doing like pack and go meals. That's a great idea. Just to help stretch the food that's in the house and also support the local businesses.
Yeah, I know a couple of my friends that own restaurants. You know, I talk to them, and it's devastating for their family and older. And it's so ironic that, you know, they're all concerned about their employees. They're all concerned about their families and helping them. And they're trying to come up. I know a couple of them have partnered up with Grubhub and, you know, done curbside pickup, but it doesn't amount to the amount of flow that they were getting. So even my husband this morning, we went to I had to go to Target because I'm like, I have to get more like puzzles and activities for the kids.
Mhm.
And because I definitely don't want them on the electronics all the time. And he wanted a tea, and I said, well, there's a Starbucks in Target, and he's like, I'm not buying it from Starbucks. He goes, Starbucks doesn't need my $7. I'd rather give the $3 to a local business.
Right.
And so yeah, so maybe that's a way that we can help local business owners.
Right. That's a great idea. Yeah.
So, well, thank you. And is there a phone number in case people are coming into some of these situations that might need your help that they can reach?
Sure. It's 973-459-9966.
Thank you,
So,
Jordan.
we'll stick together.
Well, thank you.
Thanks a lot.